Hi, Mr. Thomas. How are you?
Hi.
My name is Dr. Nash. I'm the nurse practitioner who's going to be taking care of you today.
Good, doctor.
So I talked to my assistant, Missy, and she said you're having quite a bit of dental pain today. Can
Right.
you tell me a little bit about that?
Yeah, I got very few good teeth left. But about 3 or 4 days ago, I guess it was, I started getting pain over here, like lower jaw.
Okay.
And then I've had a throbbing and a hurt down here in my neck, too, right near the same side.
Okay.
And that's kind of recent.
Okay. Well, sometimes we use a scale to kind of get a better idea of where your pain is, and thinking of 1 being the least amount of pain and 10
Okay.
being the absolute worst. Where would you say your pain is right now?
I'd say right now it's about a 7, but as soon as I start chewing anything, it becomes like a 10.
Okay. Well, that sounds uncomfortable.
Yeah.
What have you tried at home to make it a bit better?
You know, the only thing I tried, some Tylenol, and that didn't do any good. And then I tried some pills that my wife had around from her hip replacement, and that just kind of made me dizzy and sick. So
Okay.
that didn't do any good.
Okay.
And I don't know, the pain didn't seem to go away.
Okay. And so using your wife's medication, I guess, I know it's expensive to get to go see somebody. So,
Right.
so as far as your insurance, do you have your Medicare now and Medicaid, or have you?
We've got Medicare, and we do not have dental insurance. That's
Okay.
one reason I'm concerned about this and would like the medicine or whatever we have to do to make the pain go away.
Certainly, yes. Dental care can be quite costly. Absolutely. Well, I'm hoping that together we can come up with a plan that might work. What I'd like to do is just ask you some general questions and get a better idea of kind of where you are
Sure.
with your health. And I noticed this is the first time you've seen us.
Right.
Do you have another provider that you've seen?
No, I really don't, Doc. I went to one of those urgent care places
Sure.
back some time ago, and I'd cut my finger on a glass. And it took a while for the pain to go away, but you know, I got better, and I'm generally pretty healthy. So I haven't needed to do that now. You know, I've had some problem. A few years ago, somebody said doctor told me I had diabetes, and so I started taking some medication for that. But I felt better, so I didn't think I needed to keep taking it.
Okay. And when you had this cut, did it take a while for it to heal?
Yeah, it did.
It did. Okay.
Right.
Okay. And so you haven't been on that medicine for a while?
No.
Okay. Any problems with chest pain, shortness of breath, anything like that?
No, I can walk around the farm pretty good just about every day without running out of breath.
Okay, well that's great. What about polyuria or nocturia?
I assume that has something to do with urination.
Yes.
Okay, I know as you get older, you pee more, and so I've had that.
Okay.
But I don't think it's been anything, it hadn't bothered me
Okay.
a whole lot.
Well, I have a little concern that maybe your diabetes may have progressed a little bit. It's generally not something that typically goes away.
Really?
And then certainly with a little bit of the uncontrolled diabetes, your body's ability to heal, like for example with your finger that you had cut, and then maybe possibly even with this infection that sounds like you have in your tooth, we just want to look at the whole picture.
Gotcha, okay.
So I think we can come up with a plan to address most of these issues. I have a wonderful woman that we work with, Ms. Hughes, who can help us maybe investigate where we could get you into a clinic that would work with your financial constraints. And I'd like to give her a call if that would be okay with you.
Sure.
Okay, great. And while you're here, since we have you in the office today, I'd like to get some basic blood work.
Okay.
Just to get a full picture of what's going on, check your diabetes and that kind of thing. But we're going to go ahead and get you on an antibiotic because I know you're uncomfortable,
Right.
and get you something for the inflammation
Right.
to go ahead and get that started. And Missy, who you met, is going to give you a rinse to kind of help ease the pain and reduce the bacteria that's there.
Okay.
But I'm hoping to get you in the dental clinic today or tomorrow.
Okay.
And we'll get the blood work today, but I'd like to have you follow up just as soon as you get done at the dental clinic, either the next day or the day after that, so we can kind of talk about the blood work that we're doing today and come up with a way to address some of those concerns as well. Does that sound reasonable?
Yeah, anything that would make the pain go away and help my teeth.
Absolutely. Well, let's get that blood work done, and I'll put the call into Ms. Hughes.
Okay, very
All
good.
right.
Thanks, Doc.
Thank you. It's nice to meet you.
Nice meeting you.
Well, thanks for letting me have a look in your mouth.
Mm-hmm.
Let's talk about this a little bit.
Okay.
When I looked in your mouth, I can see that the tissue down there on the lower right, where you were telling me that it was so uncomfortable,
Right.
it's really swollen, it's inflamed, and when I took that instrument and felt around the teeth, it bled real easily, and there was also some infection that was obvious there. There's some pus in that area whenever I was feeling around the tooth, and I can feel some hard stuff underneath your gums. So I can see plaque, and I can see tartar or calculus, and I can see the infection that's there because there's pus, and it just looks like it must be real uncomfortable for you.
It is. Yeah. Does it sound like I have an abscessed tooth and I might have to have a root canal? Because what I'd rather do is just pull the damn tooth and get it over with.
Well, there's two different kinds of abscesses, and the kind of abscess that you have is not the kind of abscess that can be fixed with a root canal, but it's actually easier to fix because it's a gum abscess instead of being a tooth abscess.
Okay.
So no, I don't think you're going to have a tooth taken out today, but we do need to do some work on it.
Yeah.
And I wanted to talk a little bit about, you told me that you were mentioning the fact that you'd had been diagnosed with diabetes before.
Yeah.
Can you tell me a little bit about that?
Yeah, some time ago they said that I had diabetes and they gave me some kind of medication for it, and they said to kind of watch the level, and my wife helped with that a little bit, and it became like normal, and so after my pills were out, I just didn't go back and get them refilled because I didn't think I needed them anymore. So I thought the diabetes was pretty well gone away.
Okay. Well, diabetes usually doesn't work that way. And so that's one of the reasons why your nurse practitioner was so concerned and sent you to see us, is because sometimes abscesses like this in the mouth are related to diabetes that's not well controlled.
Oh, really?
Sure enough.
Okay.
And I don't want you to have any more trouble with any of these abscesses, so what we need to do today is we need to take care of this abscess now. We need to be sure that we check your mouth so we can see whether or not there are any other spots that you might develop these abscesses and get you healthy in your mouth.
This nurse practitioner had said she was concerned about the diabetes too. And I thought she was kind of imagining that, so I didn't pay much attention to you. You just said what you said. So I probably screwed up when I stopped taking the diabetes medication just based on what she said and what you said.
Well, it's real important for you to be sure that you go back to see the nurse practitioner.
I'm so glad you came by. I certainly have some concerns and want to learn more about him. He has a lot of barriers to his care. We're concerned about the dental pain, certainly, but some of his lab values came back abnormal, and we're really interested in trying to develop some kind of a plan for him. Really glad you could get him into the dental clinic, so anxious to hear more about what's going on.
Yeah, you're right. It's a very complicated situation. They live in a old farmhouse. It's neat, it's tidy, however there are some improvements that they need to make, but they really just can't afford it anymore.
And you keep saying they, and I guess you're talking about his wife. I know she recently had a hip replacement. Is there anyone else that lives with them?
So yes, it is Mr. Thomas and his wife, but they also have their granddaughter who they've raised. Their son passed away when I think he was in his 30s or 40s, but he left behind a 5-year-old daughter, and they've raised her, and now she's in her early 30s. But my understanding is that she works at a local nursing home, and on her off days, she really spends time at her boyfriend's house and lives there with him. But she also has a very young son, and so Mr. Thomas and his wife are helping to take care of the young son, so it's their great-grandson. They also are having a lot of trouble in terms of some of their health problems. So Miss Thomas, like you said, recently had hip surgery. She has a hard time moving around, not very mobile. She's also obese, and she has arthritis problems as a result of that. So really they're struggling right now with a lot of things. And it sounds like that the granddaughter helps out when she can, but you know, her income's also very limited. Yeah, so they do have limited access to fresh fruits and vegetables. That's a huge issue for them. Primarily this all goes back to income. They
Sure.
have, you know, they're on a very, very limited income, so it's very hard for them to have access to you know, nutritious foods. So they're eating a lot of starches, they're eating a lot of beans, a lot of different things that aren't necessarily the best for their diet. They're also, you know, they seem to have a lot of sweets around the house, a lot of bread. They did mention that their great-grandson that lives with them, he does receive meals at the school.
Oh, good.
So that's helpful to them. But I am concerned for him, you know, what he does when he's not at school and is eating with them. So,
Well, certainly with her being obese and you know, we're looking at some diabetic issues with him. You know, that's certainly an area of concern. I really appreciate all your help and information. It's been wonderful to identify some of these barriers that we can work on together to kind of come up jointly with the Thomases and try to come up with a plan that will work for everyone.
and I'm very committed to helping this family. I'm actually going to be in contact with KIPTA, our area agency on aging, and I'm going to talk to the community organizer about helping us set this up so that we can get them maybe a meal delivery program or something going, which would help them with the nutrition part.
Wonderful.
So I'll keep you in the loop about what's going on with them.
Great.